Social connection has been shown to really help with grief, especially that complicated grief. It really helps patients and caregivers really cope because in this space, you do feel that validation and you don't feel alone. And many times when we are grieving, so if we have a loss of something, so, we're talking about cancer here, you have a cancer diagnosis or, you're a caregiver for a patient, you feel the loss and it can be so many things. It can feel lonely and it can feel confusing. And when you are grieving, many times you've never been there before. So you don't know how to be, but then who people perceive you to be, you feel like you still have to show up as that person or who you perceive yourself. It's just all complicated. How am I supposed to behave, right? Like I'm grieving, I'm feeling these feelings I've never felt before, but I still have to show up to work. I still have to show up as a mom, a dad. It becomes very complicated and you're doing things that you haven't thought you would do, or you don't know what to do, right? You don't know what to do with all these feelings that you're having. But when you're in community, you get the validation and you get to take off your mask, be heard, be seen, be validated, tell your story, hear others' story, help others, right? What's helping you? And one of the barriers that I see with community is that people want to kind of keep things private. When you're grieving, sometimes you've never done it before. So I always say when you haven't done something before, you're experiencing something for the first time, the biggest thing is you have to be open. You have to kind of reevaluate that and be open to change, open to try something different because you've never been here before. I don't know what this is, right? This grief, these feelings. So if you're open to it, you can definitely open yourself up to really cope with the feelings and grief that you may be having.